Hi, my name is John. Today I'm going to talk about two lingual papillomas. Definition. It is a beginning lesion that affects children and adults, but has a certain predilection for people between 13 and 50 years of age. The location sites are toe, soft pellet, uvula, frenulum, and vermilion. Clinically, they have a cauliflower-like appearance, a finger-like surface, with exophytic growth and a sessile base. Its coloration depends on the degree of keratinization and can range from white to pink. They are generally solitary, painless lesions of an approximate size of 1 cm of diameter and of rapid growth. A form of HPV contagion is by direct contact. These lesions are caused mainly by HPV subtypes 6 and 11. Application in medicine. If a patient has a papilloma in this toe, he should be taken to surgery to undergo a surgical procedure which consists of the application of an anesthetic block of the left lingual nerve or both. Then, the surgical excision of the lesion, and after performing hemostasis and suture, analgesic and antibiotic therapy is ordered for 7 days. And finally, 7 days after the procedure, a good soft tissue healing process was observed.
Treatment of papilloma is generally surgical. Take the patient to the operating room and perform a direct laryngoscopy, inspecting the entire larynx, and a bronchoscopy, which means looking down in the trachea to make sure that there's no spread of the papilloma down into the deeper airways. Important to know is that the papilloma is just on the surface, it grows just on the skin, so we only remove just the papilloma down to what's called the basement membrane at the very bottom of the skin, preserving all the normal structures, especially because we know it's probably going to come back and you're probably going to have multiple surgeries. So it's most important to remove the papilloma, but it's just as important to preserve the healthy tissues so that we preserve the voice as much as possible as well.
Pros and cons. The intraoral examination is very important for the diagnostic of pathologies, but another fundamental aid is the interrogation, where reveal information of the patient or relative is provided, which can give the professional in the area to diagnose the pathology. Sexual transmission of HPV is widely recognized as one of the cases of genital, anal, and oral warts, but it was also being revealed that the virus can be acquired through non-sexual routes, such as vertical transmission and in the pregnancy period. Risk of contagion by HPV also affects the dental professional, the auxiliary personnel, and the patient who go to the consultation.
A certain kind of HPV is now the leading cause of tongue and tonsil cancer. Dr. Ted Technos is here to share more about what we need to know.
When I first started in ENT, I would see 20% of my patients with these types of cancers. Now it's upwards of 50%. And between the years of 1988 and 2008, cancers of these areas have increased by 300% due to this virus.
How many patients does this affect?
Looking at individuals across the country, there are about 8 million people infected with this virus. Of those, not all will get cancer, but we know that an increasing number is developing cancer.
How is it transmitted?
Certainly kissing is able to transmit it, and more intimate contact as well. And the scary part about it is the individual doesn't know they have it. 10% of college students have it. And that's in a time in life where you have a lot of contacts with other individuals, and it can be transmitted through the saliva.
What treatments are available for this kind of cancer?
The best treatment is prevention, and prevention is 100% effective against the viruses that are in the vaccine for HPV. Now, once you have the cancer, we have very effective treatments that consist of chemotherapy and radiation therapy with more advanced stage tumors. And then with earlier stage tumors, we can remove the tumors from the inside of the mouth and throat and remove the lymph nodes in the neck.
What research is being done at the James?
We're the leading center for HPV-related research in the United States. So we're doing many types of investigation for these tumors. So one of our scientists has actually figured out how the virus causes the cancer and has developed a drug that turns off the virus and has been shown to be highly effective in the lab, and we're hoping to submit that to the Food and Drug Administration for approval later this year. Other research that's being done is looking at the genetics of these tumors and developing a better understanding of what genes need to be turned off to make these cancers go away. And then finally, immunotherapy, which everyone is talking about, is very important in these malignancies because since it's a virus, the body wants to get rid of the virus, but these are able to evade our immune system. So being able to target these tumors with our own immunity is going to be a very important step, which we're studying intently.
Learn more at Cancer.
Issue applied in Ecuador. The human papilloma virus is a disease of worldwide affection. Thus in Ecuador, science advance is the course of the times of this issue have not progressed. Therefore, it is of utmost importance to carry out cross-sectional discretion research to have a reality of this issue. Science in this phase of individuals who suffer from it and the ignorance of its association in the oral cavity, diagnosis and treatment are not carried out once they are diagnosed in other areas of the body such as the genitals. Conclusion: we must take this empty into account in the diagnostic of atrophic pharyngopathy and in all toe-based hypertrophic, especially patients in risk group. Thank you.